Chapter 32, Complementary and Alternative Therapies. These are the objectives for this section of the chapter. Okay, so when we talk about complementary and alternative medicine, complementary um, therapies, complementary therapies are therapies that are used in conjunction with your traditional medical treatments. So maybe you're taking a prescribed medication in combination with yoga or something like that or whatever. We'll talk about different types here shortly. But complementary therapies are therapies that are used in conjunction with your traditional medical treatments. Alternative therapies are used instead of your mainstream medications or your mainstream treatment. So complementary therapies is used in conjunction with, and alternative therapies is used instead of. These complementary and alternative therapies can be very expensive, and many times they're not really covered by your insurances either. The National Institute of Health's National Center for Complementary and Integrative Health. This organization was established to research these different therapies and try to provide some evidence-based research on the therapies and provide, different information to the public. When you talk about integrative medicine combines your conventional and your complementary therapies. Okay, two main categories of complementary therapies that we'll discuss in this chapter are mind and body interventions and natural products. Mind and body interventions those are techniques to enhance the mind's capacity, whereas your natural products includes things such as your herbs, your vitamins, your minerals, your probiotics, things like that. And then there's other complementary interventions also, such as um, naturopath, um, Chinese medications or Chinese medicines, things like that, or other types as well. Okay, so one type of mind and body intervention is acupuncture. So acupuncture is a type of Chinese medicine in which they use needles are placed in different pressure points in the body, and so they're used to control. They can, people use acupuncture to help control pain. Also, they use it to increase a person's immunity or improve a person's immunity. But you have to keep in mind because needles are being used, so you still have to take precautions to prevent diseases such as HIV and hepatitis, things like that, because these are still needles, and so you want to ensure um, proper precautions are being taken to prevent, such diseases. Yoga is another mind and body intervention. And so yoga combines exercise, controlled breathing, posture, and mental focus to help bring about, certain effects with the mind and body. And so people have used yoga for a wide variety of things. It can help regulate your blood pressure, your heart rate. It can help to increase circulation, help with digestion. People have used it if they have chronic back pains and things like that, or some things that people might um, consider yoga to be beneficial for. All right, so chiropractic therapy is another type of mind and body intervention. And so chiropractic therapy uh, uses manipulation of the spine. So they're manipulating the spine to try to bring the spinal components back into alignment. And so, therefore, this is used to decrease or eliminate pain for these individuals. And so, a lot of times with chiropractic therapy, they'll use that in combination with something else, such as ice, heat, exercise, or some type of electrical stimulation. But chiropractic therapy has been used to help with pain. Okay. Massage. Massage is another type of mind and body intervention. And so this uses soft tissue manipulation. So they're manipulating the soft tissue, and it's used to relieve muscle pain and promote comfort in patients or individuals, period. Um, you've got to keep in mind though, with massage therapy, it should not be used in people with thrombophlebitis or blood clots because if you're massaging an area with a blood clot, the blood clot can break loose and travel somewhere else, causing an embolus. It could travel to the brain and cause a stroke. It could travel to the heart and cause a heart attack. It could travel to the lungs and cause a pulmonary embolus. So, if you have individuals with thrombophlebitis, you definitely do not want to use massage for them because, like I said, it could break that clot off and cause it to travel elsewhere in the body, causing other complications. Relaxation is also a form of mind and body intervention. And so, with relaxation, we're trying to ease a person's stress, which can be helpful, with certain illnesses by decreasing stress, reducing stimuli. It can be help to, help with the person's comfort and pain. Okay, so imagery is also a mind and body intervention. And so it uses visual stimuli to try to decrease stress and promote healing. And so what it is, the person can do it themselves where they imagine their happy place, their comfort place, or whatnot, or we can do guided imagery in which you, as the healthcare provider, can guide that person to that happy place. So you, for example, you're uh, having them to close their eyes, imagine themselves on a beach with the wind blowing through their hair and the waves flowing, and taking them to a comfort place, or whatnot, which is getting their mind off of the pain. So trying to help to decrease their pain level with this imagery or guided imagery if the staff person is doing guiding them into the imaginative place. Okay, meditation is another mind and body intervention. And so the person with meditation, the person um, focuses their attention on a single repetitive stimuli, and that can help the person to um, clear their mind, decrease all other outside stimuli, taking them to this restful place, and their vitals begin to lower, their heart rate lowers, their respiration lowers. And so this can be used to decrease anxiety, improve a person's mood, and decrease their irritability. And so if they can do those things, then it can help to promote wellness as well. Okay, with biofeedback, this is also a mind and body intervention. And so with biofeedback, sensors are taped to the body. And so what they're trying to do is train you to control your some involuntary processes such as your heart rate, your blood pressure. So it trains you to decrease your heart rate and decrease your blood pressure, and thereby you'll be able to decrease your pain level. They've used it to treat individuals with migraine headaches. They've also used it to treat people with chronic pain as well. Okay. Biofield therapies are mind and body interventions that use energy fields. And so, one type of biofield therapy is Qigong. Qigong is a Chinese system that uses breathing. So your breathing control, physical exercise, and meditation. It combines all of these things. And so it's been used to help people manage chronic diseases. It's been used to treat fibromyalgia pain. It's been used to improve coordination and promote relaxation. And so this is just one thing that, that is the one type of biofield therapy. It's also a mind and body um, uh, intervention, just using energy fields. All right, two other types of biofield therapies, Reiki and therapeutic touch. And so with Reiki, that channels energy to the patient, and the patient's body does the healing. Um, and so it's been used to promote relaxation in patients, reduce stress and anxiety, and promote a positive mental state. Therapeutic touch alters the body's energy fields to restore natural healing powers. I I actually have a video on Blackboard posted for you to see what therapeutic touch looks like. And so it's been used to help the patient relax, relieve pain, and heal wounds faster, and things like that. And so with that, the hands of the practitioner are just passed over the patient um, to determine, where the tension spots are, um, and excessive energy might exist, and try to redirect those tension spots, and uh, reestablish balance within the person. Okay, so another mind and body intervention is hypnotherapy. And so hypnotherapy has been uh, when the practitioner can put the person in a hypnotic state, and it's been used to try to alter a person's behavior, retrieve memories, or even induce anesthesia. A lot of people have actually used hypnotherapy to help them stop smoking and lose weight. Um, and so not everybody can be hypnotized, but those that are able to be hypnotized, they say it can be beneficial in trying to change behaviors or retrieve memories or things like that. Okay, some other mind and body interventions. People have used music, art, dance therapy. These things can help individuals express their feelings. It's a way for them to be able to express their feelings. And so then they can thereby reduce their stress, reduce their anxiety, help them relax. It could be a distraction from pain, for these individuals. Um, so it can be very, helpful. I know on some cancer units, I've especially seen it like in children's cancer units where they may use some of these, especially the art therapy, as a way to help them to express themselves, and kind of takes your mind away from um, the pain and things that you might be having, and allow you to relax and whatnot. Okay, humor can also be considered a mind and body intervention. It can be considered a mind and body intervention that because it can help a person um, to speed their healing, decrease their pain levels. Because if we can decrease our pain levels and get our minds off of it, then we're not focused and stressed out on it. And that if we're not stressed, that can help, speed up our healing process, because stress can aggravate, some conditions or whatnot. But you want to be sure you understand how humor is viewed in your patient's culture before you start using it. So make sure, first of all, you have a rapport with your patient, and you know if it's accepted in their culture, because you can't just start, making jokes and whatnot, and it be offensive to your patient. So make sure you understand your patient, their culture, and how they feel about it before you start using humor. Prayer is another mind and body intervention that can be effective in healing as well. Prayer can be used by individuals. It can help them decrease their stress. And again, if their stress is decreased, that's going to promote healing and stop their, some cases stop their disease process as well, if we're, able to decrease that stress level. Now, just because your patient doesn't have a religious affiliation, don't assume it's okay to just call the hospital chaplain up to start praying for the person. You want to talk to the person about it and see how they feel about the situation. If that's not something that they would typically do, you can, ask them and see. But many people already, practice it and find it to be helpful. Okay, question 1. Sarah's patient is nervous about a painful procedure tomorrow. Her patient is using a visual stimulus to produce a particular physiologic change that can decrease stress or pain. Her patient is using which relaxing therapy? Your answer here is imagery. So remember, imagery uses a visual stimulus to produce a physiologic change to decrease stress or promote healing. It may produce an effect on all the other major systems as well. And meditation, remember, that's focusing your attention on a single repetitive stimuli. And biofeedback, that's a technique used to train a patient to decrease their symptoms by learning how to control those involuntary um, measures, such as decreasing the pulse rate, decreasing the heart rate or the blood pressure, or something like that. And then hypnotherapy is used to um, uh, alter a person's behavior or retrieve memories or something like that. These are the objectives for the next section of this chapter. Okay, so now we go on to natural products. So first, when we're talking about natural products, we've got herbal therapy and aromatherapy. Herbal therapy uses plant ingredients to treat various conditions. So it's important when you're doing a medication review, as we've stated before, that we find out what um, um, any herbal medications that they may be taking as well, because herbal medications can still interact with our traditional medications that may be prescribed with our physician. Aromatherapy uses oils from plants to evoke pleasant feelings. They can be absorbed in the skin or they can be inhaled. So you also want to be careful with aromatherapy because you can still have some allergic reactions to aromatherapy as well. Okay, so these are a list of some commonly used herbal medications. There's actually a table in your book on 32.1 that lists different herbal meds, what they're used for, and just some things to, be aware of. Let's just look at a few of them. For example, cranberry, that can be considered a herbal therapy, and a lot of times individuals will use that to prevent urinary tract infections if they have issues with urinary tract infection, because it can help with the pH. But remember, excessive amounts can lead to GI upset or diarrhea. And so, also, if they're taking warfarin, which is a blood thinner, you want to be careful with that as well. Ginger is another herbal therapy that individuals use for nausea and vomiting, for women that are pregnant. But you got to be careful with that as well, because it can increase your risk of bleeding. It can cause diarrhea, heartburn, and things like that. Let's look at one more, ginkgo biloba. Ginkgo biloba, they've used that to help improve memory. And so, um, uh, you gotta, be careful again with that because it can cause headaches and GI symptoms and increase your risk of bleeding as well. So, like I said, you have these different herbal medications, but they can still interact with certain medications that you might be having or cause, allergic reactions or different things. So, it's very important when you're doing a medication review that you understand any herbal medications that your patient may be using as well. So, homeopathic medicine, we've got these are other complementary therapies that can be used. Homeopathic therapy. So, homeopathic therapy is uses the patient's natural defenses to try to alleviate the disease. So it says the disease can be cured by giving small doses of substance that produce symptoms of the disease. And so thereby you would stimulate the person's natural defenses to alleviate the problem. So it has three principles: like cures like. And so the greater the dilution of the remedy, the greater the potency, meaning the lower the dose, the more effective it would be. And the illness is specific to the individual. So one example of this, people have used a dilute solution of coffee to try to treat insomnia. And so basically, like I said, you give small doses of a substance to produce symptoms of the disease, which will cause the person's defense mechanisms to kick in, and then thereby alleviating the problem. Okay, so naturopathic medicine uses natural means to try to promote health. So, for example, lifestyle management, having a good lifestyle, not having risky behaviors, things like that. Natural foods, um, your raw fruits and vegetables, things like that. Massage, regular exercise, maintaining high levels of wellness. So just using natural means to try to promote health in an individual is what naturopathic medication or naturopathic medicine is. So other complementary interventions include your traditional Chinese medicines, which we've talked about a couple of. Acupuncture, remember we talked about that one. Qigong, remember we said that one was combining breathing control, physical exercise, and meditation. Tai Chi is also a type of Chinese medicine, and that one uses gentle physical exercise and stretching to try to promote um, wellness and relaxation. And massage can also be considered a type of traditional medicine as well. Okay, question 4. Chloe's patient states, I often use herbs when I am nauseated. Which herb would Chloe's patient use? The answer here is ginger. Ginger is used as an antiemetic, remember. So helping people that have nausea.